Hello, my friends, and welcome back to another episode of the Dental Hygiene Basics podcast. My name is Dana. I am your host, and I'm really excited to be here. I recently had a listener reach out. Actually, they left me a really kind review on my podcast on Apple. So thank you so much for that. And in that review, they asked, I'd like to know some of the downsides of dental hygiene because I'm interested in this career, but it'd be nice to know what are some of the cons. If you've been listening to the Dental Hygiene Basics podcast for a while, everyone who comes on my show, and myself included, we love the field of dental hygiene. And not to say that we've always loved it or that we've loved it every single day that we've been practicing, but we love our careers. And you're going to hear and feel that passion in all of my guest episodes. But I think it's really important for you to hear what are some downsides to the career, because this is a big decision that you're making and it's not one that you should make lightly. So without further ado, let's dive into some cons of the dental hygiene profession. If you're on social media, you'll see all negatives, right? Everyone's just like, don't do it. Don't become a dental hygienist. And so you'll probably notice that there is going to be an air of positivity. Everything that has a downside, I think there can be an upside. And I think that there are ways to manage everything. If we think about our lives in general, our lives are not easy. They shouldn't be, right? The hard times are what make us appreciate the good times, and everything is transient or temporary in life. So good things are temporary, bad things are temporary. But my thought process is all problems have solutions, and you just have to be willing to find the solution. Does it happen overnight? No, it can take time. It's taken me a long time to get where I am truly 100% happiest. And do I think I'll be happy forever? No, things are going to come up, right? I'm going to have to pivot, make changes. So really what I want you to go through life doing is checking in with yourself regularly and seeing, where am I on a daily basis? Like if you're crying every day in your car, you're not doing good, right? We need to find the one big thing, change it, and then start making micro shifts in other areas of your life to get you back to your best self. And I can say that from experience because I went through some really tough times when I was working clinically as a dental hygienist. And I'm sure all of that is going to be sprinkled into today's episode. So let's really get into it and talk about the things that hygienists are complaining the most about. Okay. First things first, physical pain. If you are going into a career in dentistry in general, it is really hard on your body. You are bending over, your neck is down, you're using fine motor movements, you are applying pressure, you're squeezing instruments, a lot of static postures, meaning you're just sitting still for long periods of time. And all of those things are known risk factors for musculoskeletal disorders. Musculoskeletal disorders are exactly what they sound like. It's a disorder of your muscles or your skeletal system, or the two combined, right? And there are many that hygienists are at risk for. A big one is carpal tunnel, which is inflammation of the median nerve in your kind of hand wrist area. So that's just one example of something that hygienists are usually really upset about, right? Maybe they did not know going into it that they might come out of it with chronic pain. I personally have had several injuries related to practicing as a dental hygienist, and I started having pain as soon as I was in dental hygiene school. I want to preface that though by saying that I do have endometriosis and I have chronic pain associated with that. And so my pain, inflammatory levels, all of that are maybe higher than a typical person. But I want to mention it because if you have maybe an autoimmune condition, rheumatoid arthritis, multiple sclerosis, endometriosis, something that creates chronic pain in your life, I want you to know that it doesn't mean that you can't be a dental hygienist. You just may have to practice differently than others. You may have to make more modifications. You may not be able to work as many clinical hours as someone else who doesn't have those issues. With that being said, because of the risk of injury as a dental hygienist already, whether you have chronic pain, autoimmune diseases, other issues already, if you don't, it doesn't mean that you can't end up with chronic pain anyways, just because of these micro movements over time. So regardless of where you're at going into this, we have to make you the priority. And I recently did a podcast episode a while back about protecting the asset. You are the asset. And I really think we put so much energy into everything else external to us that sometimes we forget that we should be pouring in just as much energy into ourselves, physically, mentally, spiritually. Part of preventing pain is doing it right from the start. I can attest, I had pain from day one in dental hygiene school. I did not do what I could have done to make things better on myself. If my instructors weren't watching, I was probably bending the rules a little bit on ergonomics, meaning I was bending over, I was doing what needed to get done to get the job done instead of taking the opportunity in school to be like, I have 4 hours per patient. This is the time to set up those really, really good habits. When I got out, I just defaulted to anything that made what felt like the job easier in the moment and quicker, but that ended up sacrificing my own health. So I got injured within a few weeks of becoming a clinical dental hygienist after I graduated. Okay. And you want to know how I got injured? It was so stupid. I was bending over. There was a little control panel on the side of the chair. I would bend over to lay the patient back using that control panel on the side of the chair. And that constant bending over, it got to where I could bend to the right, but I couldn't bend to the left. It was so silly, right? But that was an injury that I have. I have ongoing chronic pain in my neck and shoulder. I'm 37 years old. For perspective, I've been a dental hygienist for 10 years. I've always dealt with various back pain. It got pretty significant by, I would say, a year and a half, 2 years in. I would say 3 years in, I was in pain every single day. And my mood started to get really, really affected. And it made me more grumpy. I don't think that I showed the patients that. I think they saw normal Dana, but inside I was really miserable. Again, there was a lot happening at that time as well. I was really struggling with endometriosis. I was working with a not so great employer. There was a lot of struggle in my life at the time. So it was not just the pain, but pain is like this underlying hiding thing that can impact you and you may not even realize it. For me, the pain bothers me when I'm sleeping. It bothers me when I'm driving. So these normal routine everyday tasks get kind of frustrating because my sleep is impacted. So, I mean, if you're watching the YouTube video right now, you can see that I look really tired. I do struggle to sleep. And part of that is I'm constantly switching positions, trying to get comfortable. But again, I have some other things that I'm handling or dealing with as well medically that impact that. So I just want to be straightforward that pain could be a part of your life in the future. Anything you could do to prevent that is going to be top notch, right? So invest in the ergonomic loops, get fitted for a saddle chair, whatever it is that causes friction in your day-to-day motion and everyday life, you want to address that sooner. Also, you want to be strong. Your muscles are going to be working all day long, whether you realize it or not. So having strength, putting money towards preventive care, massages, chiropractor, whatever that looks like for you. I love muscle cupping, where you use a little cup to drag it over your muscles. It may look different and it may take time to figure it out, but you are the investment. And to continue practicing long term, you do want to take the best care of yourself. With that being said, I want to just mention that my career progression will look different than yours. I knew that I wanted to go into dental hygiene education. I was just planning to work 5 years clinically and then transition into education. My pain and my endometriosis kind of made me move quicker in that direction. I transitioned to teaching as soon as I could. I started my master's right away. But even when I was working as a dental hygiene instructor, I had a lot of pain because I was still in the clinic, bending over, looking at my students' patients, right? Getting into weird positions. My hand would like ache and cramp from holding the clipboard. So again, I am prone to chronic pain, but it didn't get better when I got out of clinical. And I was only 5 years in at that point. And so I just want to mention that you have to be aware of you and your body, but you also have to be aware of what you're doing to your body on a daily basis. And I really was not putting in the care that I could have. I'll tell you why. It's because I was struggling so much with fatigue and pain and everything that it felt almost impossible to care for myself. Like even just cooking was exhausting. So again, this episode is a little bit tainted by my personal experience, but I know someone out there is going to listen and they're going to think, okay, so I had to pivot, right? I knew that I was going to have to make changes. I've always been called to be an entrepreneur. And so that's where I went. And now I just work one day clinically and it's hard. It's hard on my body to work one day clinically. It hurts. Sitting at a desk all day hurts me. Okay. So I just say that you can be injured anywhere, right? You can be burnt out in any career. The negatives of what we're going to talk about today, they could happen in any career, but there's just some we're more prone to than maybe other careers, like the musculoskeletal disorders. Okay, there is a risk for chronic pain to happen as a dental hygienist. Again, prevent it. Do as much as you can to prevent it and take care of yourself. Okay, let's get on with that. So the next thing, a lot of dental hygienists you've probably heard are burnt out. What does that mean? What does that mean? There's a lot of reasons why people can burn out. Yes, it can happen from our jobs, but life plays a role in this as well. So, a couple of things that cause burnout. I think one is this relationship between the dentist and the dental hygienist. I always felt like I was just someone there to run the numbers. I was in my operatory alone. I rarely had help. And I always just felt like it was go, 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 do everything on your own. And it felt kind of thankless. I remember one of my bosses telling me once that I didn't even earn my paycheck. Like the production that I earned because of insurance wasn't enough to even like earn my paycheck every day. So it made me feel like, well, why am I even here? Like, what is the purpose of me being here if you don't even think that I'm worth my paycheck? And I want you to think about what you do, what you've learned, all of the skills that you have or will have when you graduate dental hygiene school. You are more than just what your hourly wage is. You are a healthcare provider. You can save lives. You can find oral cancer. You can diagnose disease. You can treat disease. Well, I say you can diagnose disease. You can find disease, but in many states, they won't let you diagnose it. And that's another reason for burnout is dental hygienists feel restricted. We go to school, we learn all of these amazing things. We take board exams to prove that we're competent. We're trusted to work alone in the operatory with the patient, but we are limited in what we can do. Meaning, in Texas, like I can't diagnose that my patient has periodontal disease, but I'm allowed to treat it. I'm allowed to assess for it, and then the doctor has to be the one to make the call. And that's just crazy. I do the full assessment, I do the treatment, but the one step in the middle is the diagnosis, and I can't do that. So things like that are really frustrating for dental hygienists. Also, just being able to make the call on how much time you need for that patient, how often they should come back. We get beaten down by insurance, well, that's not covered by insurance. Sometimes the patients don't want it because it's not covered by insurance. There's just a lot coming at you. And this is not just if you work in dental hygiene. This is in healthcare in general. Every healthcare provider is experiencing burnout. And a big part of that is because of the system, right? We are working under the thumb of insurances that basically are dictating how we care for our patients and how we get paid, which is really, really hard because as a dental hygienist, insurance barely pays out for it. So your doctor or your boss has an overhead. They have to make enough money to cover the cost of the office. And it can be really challenging to do that with what insurances reimburse. There are ways to grow your production. I got really good at this as a dental hygienist. I started, learning more about the business side and how could I increase production in an ethical way. I never did anything just because it was increasing production. I did it because the patient needed it. And that's a part of practicing to your full scope, right? If your patient has a moderate to high caries risk, can we do sealants on them to help prevent caries in the future if they have teeth that are unsealed and are eligible, right? There are things to think about. There are ways to maximize and make you more worth your value in the dental office. But you can only do that if you feel appreciated. And I think a lot of dental hygienists don't feel appreciated. I think that I could sit in this exact same conversation with a dentist and ask them, do you feel appreciated? And the dentist would say no. I could ask the dental assistant, do you feel appreciated? And they would probably say no. I could ask a nurse, I could ask a doctor, I could ask a speech language pathologist, a dietitian. It doesn't matter who you talk to. I think the problem is that a lot of people kind of lose and disconnect with their why. And I think basically people just feel like they're spinning in a hamster wheel day in, day out. And they feel like I went into this because I was excited about it, ready to make change in people's lives. And then they just feel like they get beat down by all the things. I'm just going to be very honest. For me, my beat down was the way I was treated by my employers. I always felt like I had some really bad scenarios, like really bad, that made me want to leave clinical completely. And I still have some PTSD about going in and like working in a traditional clinical office, which again has kind of spurred me to go out and try different things because the thought of going back to a clinical dental office is really stressful for me. I hope one day I can get over that. I truthfully think for me personally, the things that I didn't enjoy, like the way I was spoken to as an employee, not having the equipment that I needed, not having the help, the support that I needed. Even though I was working really hard and felt like I was doing a good job, I just didn't have what I needed. I didn't have good instruments. I didn't have, all sorts of things, but mainly I didn't have the support. And I felt like I was walking on eggshells all the time just trying to keep my employer happy. And that really messed with my head. And I got to a point where I was like, I don't want to do this anymore. I felt boxed in, I felt trapped. And personally, for me, I've recognized that that didn't go away when I got out of clinical dental hygiene, which I think a lot of people think. So you'll see now a lot of people who are like, if you're unhappy in clinical, get out of the op and do something out of the op. Okay, I did that. I've been all out of the op, doing all sorts of things. I personally was not happy until I opened my own business. And because I think that's because of the type of human that I am. I was never going to be happy in those scenarios. So people who are really, really unhappy in a clinical career or in a teaching position or whatever it may be, I really think they should look and see what is the driver behind what is making you unhappy. For me, I'll tell you, it was multifaceted. It was pain that I was having. It was my endometriosis was really making my job hard. It was not having the right equipment, and it was the way I was being treated by the doctor. With that, I stayed in that job for way too long and I was miserable. That was on me. I didn't make that first change, right? To get out of a place where I didn't feel safe and I didn't feel supported. And so what that did was it led me on a cascade of burnout. Through that cascade of burnout, I ended up in teaching and I recognized, oh my gosh, I love to teach. This is my passion. I was so happy. But what happened? I got burnout again. Why? Because I always feel like I'm giving, 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 right? But I feel like I'm up against a wall. I don't like to feel trapped. And for me, I felt that way in clinical. I felt that way in teaching because I always felt like someone was telling me what to do. That was my clue to me. I'm supposed to be an entrepreneur. Okay. You may have the other situation where you're really happy treating your patients, like you're happy with the repetitiveness and seeing how your patients respond. But maybe one thing is really driving you crazy, right? How can you fix that one thing? So for me, I use my dissatisfaction as a sign that I am out of alignment. And I think a lot of people aren't doing that. They're willing to complain on social media about how dissatisfied they were or are, and they're not willing to really start moving forward and making the change for whatever reason. For me, I didn't do that for 2 years and I should have, right? So keep in mind, I'm not saying I'm immune to this. I'm just saying that the more you start checking in with yourself and self awareness, the better opportunity you will have to catch something before it becomes a serious problem. I did not do that multiple times, and I paid the price for it multiple times just with physical exhaustion, mental, just like depression, anxiety. Okay, so again, why am I going into so much of my own personal story? It's because I use everything that I did not like about dental hygiene as a reflection to work towards the life that I wanted. I love taking care of patients. I particularly realize I love working with children. So now I work 1 day a week with children and it's part time and it works best for me and my body and my pain, right? So I'm figuring out ways to work best with me. I think a lot of people get stuck, they get dissatisfied, and they're not thinking about how they can really start fixing the problem, or they just want to complain until they're ready to fix the problem, right? But you have to get out there and start trying things and being okay with being uncomfortable a little bit with that trying of new things as well. With that being said, many people think that dental hygienists have limited career paths, and I think that could not be further from the truth. Many people think, oh, you can only be a clinician, like a classic dental hygienist. You can be in education, right? Or you could be in sales. Many people think that's all you can do. Honestly, if you are entering into dental hygiene, I think you're entering in at a time where the sky is the limit. There's corporate roles, there's sales, there's education, right? But there's also a lot of avenues for entrepreneurship. There's hopefully, get out there, become a part of your associations and your alliances and help us fight for autonomy. I think that if I had had the opportunity to work on my own and own my own dental hygiene business as a dental hygienist, which you can in some states like California and Colorado, I think that if I could do that, I probably still would be working clinically some days. It may not be the classic situation that you think of when you think about a clinical dental hygienist, but that would make me so happy because I love being an entrepreneur and I'm good at it. And I'm also good at being a dental hygienist. So dental hygienists have a lot of transferable skills. You're good with people, you're good at problem solving, you're strategic, you are good at organizing and having good systems. And that is, like I said, a transferable skills that can be used for many different jobs. And if the job you want doesn't exist, go out there and create it, right? It's possible. It just requires hard work. And that's all I have to say about that. I think that you are limited by your own mind and your own view on things. If you put yourself into a box and say, this is all I can do, then that is all you will ever do. Okay. Some people don't like inconsistent scheduling and income. I really think, some of that comes down to your employer, who you're working with. If you have a last minute cancellation and your boss wants you to clock out, things like that, it can affect your income. I am the type of person where I like to have multiple streams of income at all time. I don't want to rely on just one thing because then I know that money will always be there. But that's a little bit of like a fear of mine, right? And so that's something I'm working on is, okay, how do I trust that I will always have enough money? And I went through a whole thing. We paid off all our debt. We've got a savings now. We're investing to make sure that I can feel more confident moving into the future about all of that. So I think some planning on your part in terms of finances and thinking through that on the front end, like, am I going to temp? Okay, if I want to be a temp hygienist, I have to be aware that there may be days where nobody needs a temp and I may not be able to make money that day. So what am I going to do? Is there an alternative? You have to just be thinking a little more forward thinking about things like that. But I would say for the most part, a career in clinical dental hygiene is fairly stable. Like in terms of you're probably going to have patients, you're probably going to get fairly paid, and you're probably going to get paid fairly well. Okay. If you're not, you should be looking at why. This may not be the best office for me. Or maybe you're really happy and you're okay with less pay. And that's fine as well, because I've done that several times. Another thing that is a con, patients can be a con. Patients are the pro and the con. They can be the best part about dental hygiene. They can be one of the worst parts about dental hygiene. But if we really think about it, I always just ask myself, in the real great big scheme of things, like one difficult patient every 6 months, it's like, okay, in the grand scheme of my life, that's really not that many, right? It's like 2 hours a year. Okay. Maybe 4 hours a year. I can get through it, right? I can get through those hours with that patient. I always have the mindset, I'm going to do anything to make this patient fall in love with me. And maybe they do, maybe they don't. But at the end of the day, sometimes our patients are just our patients and they are upset because they're upset. And you may trigger them, but it probably has nothing to do with you. And I always just think, we have to have those conversations with our patients. Like I was always very straightforward. I'd be like, you seem really frustrated today. Is it something specific? Like, are you worried about something? Can I help you with something? And they may be like, oh, I just had a bad meeting before I got here. I just want to get done with this. And you're like, hey, I get that. How about we take this as an opportunity for you to relax and let that go? Let's turn on some music, turn the lights down, and we're going to get this done. Okay. You have to meet the patient where they're at and just do what's best for them in the moment. I know sometimes that feels like giving up yourself, but really when we think about our career, we are here to serve the population. Not that you should be like a pushover, right? Or a doormat, but at the same time, I think we put up this resistance. We think I was taught in school that if they don't want the blood pressure, then I need to dismiss them right away. Or if they don't want this, then I have to educate them and I have to teach them the error of their ways. And we build up this resistance. Like we put up this wall between us and our patient. It's like us versus them, when really it's them in our chair here to see us, right? And so I just think that when we start to change the perspective, does it make it easier all the time? No. But one thing that I started doing is I am going to be my best self for my patients today, whether they can meet me there or not. And since I've started doing that, I've noticed that I just don't hold on to the patient's weight as much, right? The things they're going through, but I'm there for them and I care for them. And like I said, just meet them where they're at. With that often comes emotional fatigue, right? Because when you care for your patients and they're going through stuff, I've had patients whose their husbands have been diagnosed with terminal cancer. I've had patients who have been diagnosed with oral cancer. There's some really scary and sad situations. And sometimes you have the loss of a patient, right? Those are all really hard things to navigate. And we feel those because if you've worked at an office or even if you've worked, like let's say when I worked at the school, even your coworkers leave sometimes and you can have grief because maybe they were your favorite coworker. I've dealt with that a lot too. It was really hard. So I want you to keep in mind though, all of these things happen in any job. It's really how you manage that. And that was a lesson that took me a really long time to learn. Last thing I want to mention is the mismatch between school expectations and reality. When you're in school, you get a lot of time per patient. Your instructors, you are going to see, are very rigorous, regimented, and have extremely high standards. Because of those high standards, I think that's exactly why we should be allowed to work independently, own our own businesses, because we produce very high quality dental hygienists. I'm not saying that every dental hygienist is high quality, but that is a huge standard. Like, as a profession goes, dental hygienists have very high standards. And I think that's why we should be allowed to work on our own and own our own businesses and practice to the full scope of everything we've been trained to do. But in dental hygiene school, it's kind of like that straight to jail meme. It's like, did you leave a piece of calculus? Straight to jail, right? We put so much pressure on ourselves. We think if we make a mistake, like it's the end of the world. I use the blood pressure example because yes, we are supposed to take the blood pressure on every patient. But if your patient comes in and they don't want you to take the blood pressure, I mean, they have the right to say no. You also have the right to dismiss them. But is there a way you can meet in the middle and take that pressure off of each of you, the patient and yourself, to have the perfect appointment every single time? Because it's just not possible, And it's hard because real life, you feel rushed. You often feel like you're alone if you're a hygienist and you don't have an assistant. It can be kind of brutal. Sometimes you just feel like, man, this is really, really tough. And that transition can be really difficult between graduation and starting a career in clinical as well. But that is anything in life, right? Our expectations rarely meet our reality. You can have really high standards of care and not have internal resistance, meaning if you're like, my highest standard of care is taking a blood pressure on every patient, but you have one patient who it freaks them to all get out. I had a patient like this actually to take the blood pressure. She had seen a hygienist that worked there before me, and the blood pressure was really high. Okay. Like scary high. And the patient was freaking out. She was just panicked. She was really scared. And the hygienist kept the blood pressure cuff on the whole time and still treated her, which some would say maybe that's debatable. Maybe you shouldn't have treated her. Well, the patient ended up not coming back for like a year and a half. By the time she came back, I was the hygienist. And I said, okay, I'm going to start by taking your blood pressure. And she immediately started panicking. She's like, I brought a whole list of all my blood pressures when I'm not here. It's so high when I'm here. Please, please don't take it. And I was like looking at all of her blood pressures. And I was like, look, your blood pressure is good when you're not here. I was like, can I just take it? Simply out of curiosity. Like, we're going to do the treatment today. I'm seriously just curious. And she was really resistant, but she was like, yeah, okay, fine. I was like, let's do it at the beginning and the end. We're going to do a trial run. We're just going to see what happens. So we took it at the beginning. It was crazy high. It was borderline hypertensive crisis. So I was like, oh God. I was like, but you know what? What she needs is calming techniques. She's doing her due diligence. She's checking the blood pressure every day at home. So we checked at the end. It was still high, but it had gone down. I knew I did the right thing for that patient. What did she need more than the blood pressure monitor on her throughout the entire appointment? She needed to get comfortable in the dental hygiene chair again. She was so scared her blood pressure was going to be so high. Like I said, you may disagree with that if you're a seasoned hygienist or if you're in school and you maybe think you should have dismissed her. That is your decision, but we all have to make decisions on a daily basis that maybe we make different decisions. But that's where I say the school expectations versus reality can be different sometimes because school cannot account for every single scenario, right? It's there to train you on the broad scheme of things, but it can't get you ready for every single scenario. And that's where I say we just need to lead patient first and, protect your license, protect yourself, but at the same time, think through, how can I make this better for my patient? So that was a long-winded episode. I think the last things I would want to say is my experience is very unique to me. I mentioned a few things that you may think, oh my gosh, well, maybe this isn't right for me. Actually, I thought that clinical hygiene was going to be like the dream for me. I didn't even know that education was an opportunity, like until I went to dental hygiene school. So bear in mind, part of my experience is wrapped up in just finally learning about different avenues when it comes to dental hygiene. But I thought, okay, I love clinical. I'm going to be happy working clinical. I did not know that the pain was going to be a problem. I didn't know at the time because, I'd been in school. You're jumping from all different things. I thought like, oh, I'm going to love being in the same place, going same hours every day, like the predictability of it. I did not realize that that is not my personality. I did not realize that. Like I do like some routine, but I didn't realize that being in the same like operatory every single day, I started to feel claustrophobic. That's the best way I can describe it for me. But you have to think about the other things. I mean, that's my personality type. I love the challenge of entrepreneurship. I love the challenge of education, like having to learn something and think of a way to teach it to someone else. I like using a lot of mental energy. The physical energy of dental hygiene was really hard on me. Does that mean that I didn't like it? No. I love getting in there with my scalers. I love doing sealants. I love helping my patients. I just cannot do it as much anymore. One, because of the physical pain. Two, because it's just not my top priority anymore. My top priority now are the students because that is what makes me happiest inside. So there were a lot of reasons why I've shifted out of a career, in mainly clinical, but they were all very unique to me. So when you are embarking on this journey, you may think, yes, I know I'm going to love a career in dental hygiene, and I may love being a clinical dental hygienist for life. And maybe you will. Maybe you won't. And that's okay too. I really think we just get so bogged down with this is what I have to do for the rest of my life that we forget that you are supposed to grow and evolve throughout your life. And that sometimes what feels bad in the moment ends up being the thing that pushes you towards your best self. And that's what's happened for me. All the things that I really struggled with when I was working as a clinical dental hygienist, and what I see a lot of people struggling with too, were all the things that pushed me to find more alignment and a better, happier life and career for myself. And I just hope that you do the same. I hope you look at your life through that lens of reflection and alignment on a daily basis, right? Am I in alignment? Is my life looking the way that I want it to look? I'll be honest right now. Professionally, I could not ask for anything more. I have never been happier in my career. And I really thought this wouldn't be possible in my lowest times. But some things that I'm struggling with outside of work, like getting healthier, I have endometriosis. That's been a struggle. I had surgery in July and I'm still, kind of recovering from that. That's my main priority right now, right? So I'm learning some things a little bit different, which is we have to think about our life as a whole. And you have to think about how to bring your life together in one whole, think of it like a pie, right? You have slices of pie and one slice is career. That's only one slice. And if your career slice is making it to where you can't do all the other things, then your whole life kind of just feels like, ugh, it's not good, right? That's where I had gotten. Once I started fixing the individual slices and I got to the career slice and started to figure it all out, now it's like, oh, like life is not perfect, but it's way better than it used to be. So again, I want you to think about this in terms of how you look at your entire life, not just your career. Yes, you do your career for a large part of your life, but it is not the only part of your life, right? And so take good care of yourself, protect the asset, practice good ergonomics. And I would love to know, if you're out there listening, if you're a hygienist right now, maybe tell us, send me an email, or if you're on Spotify, you can make a comment. What do you feel like you dislike the most about your job? Or what do you think the biggest con to dental hygiene is? I would love to know. I think that the pros outweigh the cons, but I think it depends on your personality. I think it depends on your why and your motivation behind what you're doing. If those don't align, then it's probably not going to be the right field for you. And that's okay too. It's totally okay. And it's okay to try and fail and figure it out along the way. Okay. Thank you so much for listening. I hope that you found this episode helpful. And, I was rattling around with a lot of different things in today's episode, but I really enjoy sharing my story along with it and excited to learn more about you, hear more of your questions. Please send me questions if you have them. I'd love to answer more questions from you guys. So thank you again for listening. Best of luck on your journey. Future registered dental hygienist.